Hey, it's Coach Mark. I want to bring you some self-care tips for any pain you might be experiencing in your lower back or hip. Right? And oftentimes it might not be a back or hip issue. It could be related to your SI joint, your sacroiliac joint, right where your spine meets your pelvis. And so it's a common injury, common place to experience pain. A lot of times it's going to be on one side versus the other, right at the base of that, that bony prominence here at the top of your hip. It's tender there. A lot of times that could be a telltale sign that there's some type of issue going on at that SI joint. So what might cause that pain? Well, it could be a few different things. One, it could certainly be some imbalances in the muscles. There could be some weakness throughout your pelvic area, hips, glutes, the stabilizers there in particular. It could be tightness, certainly throughout your hips, hip flexors, piriformis, IT band, hamstrings. It could be any number of muscles that surround that area. It can be caused by a repetitive use, right? Heavy lifting or twisting, turning the wrong way, maybe taking a misstep. Sometimes it could be, the way you're holding yourself, right? If you're sitting with the leg crossed or you're holding onto something with your hip out, whatever it might be, it could be any number of things that cause that imbalance. Key is, how do we fix it? Well, I would generally recommend starting off with some type of soft tissue work, right? Some self-massage. So if you're able to, a stick, a foam roll, maybe a massage gun to get that affected area, get some blood flow circulation going through there. Or I always, would recommend a skilled set of hands to help you out with that. So after some blood work or some blood flow and circulation going through that area, we can work on some strengthening some of those weak areas. So if you're able to work on a few simple things, we can do a bridge, right, where you're on your ground, knees are bent. Try to stabilize that core. You're going to push through your heels, raise up, really hold and contract those muscles for a 5 count. Feel it in your thighs, your hips, your glutes, without arching that lower back. And then lower it down and repeat anywhere from 10 to 15 reps. We want to feel some fatigue in that area. Another thing that you can do is just some isometrics, where you can get yourself a foam roll or basketball, soccer ball, a thicker pillow. You can put that between your knees and again, keep that core tight and work on just trying to squeeze those knees together. Give it a 5 count and relax, and you're going to feel that more in the inner thigh and hip, and you can work on that again 10 to 15 reps or to the point of fatigue. We also want to work on strengthening your core throughout. So if we're down on your back, what we call our B4 core method, right, where we're going to focus on pulling that belly in, pressing that low back down, tightening up that backside or butt, but making sure that you are breathing, right, and really brace that core, engage it here, hold for a 5 count without holding your breath. Relax and repeat that for 10 to 15 reps. And there are numerous different core exercises that you do, but that's where we really want to start with, is that B4 core method. So strengthening those weak areas, hips, glutes, core. In terms of stretching out, if you're on your back, we can work on crossing one foot onto the opposite knee in that figure 4 position to get the backside, your piriformis muscle, where we're going to grab that opposite knee, try to bring it towards your chest, and you should feel a stretch on that back side. We'll give it a deep breath in and out. Hold for about a 5 count, let it down, relax, and repeat that at least 5 times on each side. You can also grab behind the knee, right, and try to straighten that leg out to feel more of a stretch on the back of that thigh, your hamstring. Again, give it a good 5 count, deep breath in and out. And relax. We'll try 5 to 10 times on that. And then we can try to hit some muscles on the front side. We come down into a half kneel position if you're comfortable with it. We'll bend that front knee, lean forward and feel a stretch on the front of that hip and thigh. And again, deep breath in and out. Again, at least 5 reps to feel that. I would balance it out and do it on both sides. Now, those are some things that you could do on your own. If you want some extra assistance with that, in terms of strengthening, building up that stability, core, lower body, hips, glutes, etc., our IsoStrong program is the best around. in order to accomplish that. So we can certainly help you with that. And in terms of getting more mobility, fixing that, that SI area, especially if there is an imbalance or a rotation. Like I said, oftentimes those muscles get so tight where you might be walking around with one leg lower or higher than the other, longer or shorter than the other, and could create a lot of tension and pain in that low back and hip area. So those are things that we can help correct with our background and knowledge as physical therapists. We can do that as well. So smart stretch therapy, IsoStrong, those are things we can help you out with. But in the meantime, try some things on your own, and hopefully I'll see you again, help you out with some more tips to try to get rid of any of that nagging pain you might be having. See you again next time.